Wins and celebrations?
I have one. Oh, it's Daisy time. Should I come? Right here? Should I stay here? This be easier? All right. So, all of you, I will tell you a little bit about Daisy because how long has it been since I've been here? I feel like I was here recently, but.
A couple months ago, maybe.
Yeah, okay. So if you recall, Daisy is an award that was started in the year 2000 by the family of Patrick Barnes. Patrick was a 33-year-old gentleman who was a husband, fairly new father, who unfortunately died from complications from ITP. And before Patrick died of this illness, he was in the hospital for about 6 weeks. And he lived in the Seattle area, and his family, watching the nurses with Patrick for those 6 weeks, were so touched by the compassion and the kindness in which those nurses shared with Patrick during that 6-week illness. They expected the nurses to be clinically skilled. They expected the nurses to be very knowledgeable. They were in awe of the compassion that they shared with Patrick and with all of them. So they tell the story that one night over a liquid dinner, they thought, what can we do to celebrate the nurses in our Seattle area, in their Seattle area? And they started the award, Diseases Attacking the Autoimmune System, the Daisy Award, thinking it would be a local award, and now it's in every state within the United States and internationally. And it's here in Mercy once a month, and we are celebrating Dolette, if you would come forward. This month. You are the Daisy person this month. How's that? Do I have a partner that wants to read the letter, or should I keep going?
Taylor.
I can read it.
Okay, Taylor.
It's a pretty
there you
long
go.
one, though.
It's a long one. It's a very nice one.
All right, so this was written to Tony. Dear Mr. Marquis, my name is Wanda Lichty. My dad, Charlie Lichty, was a patient on 5 West from Saturday, March 25th until Wednesday, March 29th. My dad is 86 and suffers from Parkinson's. Unfortunately, on March 25th, he fell and fractured his right pelvis. It was determined that surgery was not needed, and he would be non-weight bearing for 6 weeks. During his care, one understandable concern was constipation from pain meds. I was so happy that the potential problem was anticipated and stool softeners were ordered right away. Unfortunately, the opposite problem arose with frequent loose stools for 36 plus hours. I bring this up just to highlight the challenge for your staff, as the continual need for moving and bathing my dad in his condition is a time-consuming process for a very busy staff. I want to appreciate my sincere gratitude and appreciation to the staff on 5 West. I mean no disrespect of lack of appreciation for caregivers not mentioned. A few individuals stand out. Dolette Flugrad. Can I adequately thank and praise this amazing caregiver? Dolette is an example of a professionalism, skill, compassion, and kindness. My dad had the pleasure of her care for 2 days. Dolette is an attentive and kind at the end of a 12-hour shift, and as she is returning a few hours later for the start of another 12-hour shift. Here are just a few examples of what I witnessed. Dolette noted that my dad's IV, placed at the Algona emergency room, was in the anterior elbow of his dominant arm. Without hesitation, she changed it to his dorsal right forearm. Much better. She noted my dad's urine was dark with limited output and set up IV fluids. Yeah. Multiple times she assisted with cleaning my dad after bouts of loose stools. This is such a big deal as it is a time-consuming process due to my dad's frailty and pain. It also places my dad at high risk for skin breakdown. Cleaning my dad is of course not easy when work involves caring for multiple high-demand clients. Dolette was so diligent and thorough with cleaning, drying, and applying skin protectant, and my dad's skin is in great condition because of this. Due to my dad's fresh pelvic fracture, pain management was of utmost importance. Dolette made sure my dad's pain level was frequently assessed and attended to. She supplemented his hydrocodone with IV Dilaudid for its fast-acting, short-term benefit to help him do better with PT, and it worked. Due to Parkinson's and fatigue, my dad had significantly difficulty swallowing his pills. Thank you to the speech team for their thorough and patient assessment and helpful recommendations. Dolette made sure each pill was as small as it could be by crushing those that could be crushed and halving those that could be halved, using pudding, applesauce, and thickened liquids. Dolette made sure each pill was swallowed, inspecting my dad's mouth and pocketing with her phone flashlight. Sometimes this process was 15 minutes or more. When my dad was clammy and his blood pressure was quite low, Dolette was consistent with regular monitoring and documentation of his vitals. She also contacted the MD to discuss options for treatment. On the morning of my dad's discharge, there was a lot to be accomplished in a short time. Of course, the success of the smooth transition was a team effort. Dolette again showed her attention to detail and expertise. My dad's breakfast was delivered, and due to his continued loose stools, she advised me to Avoid the sugary portion of his food, as this can further lead to soft stools. Who knew? I think most would have not bothered with mentioning this detail. She encouraged the high fiber portion of his meal. She also had the forethought to give my dad his pre-lunch Cinemet dose before leaving, as this would be difficult for my sister to do on the 5-hour road trip to Omaha. Dolette also made sure my dad had pain medicine before leaving and grabbing a warm blanket and extra pillows to make him as cozy as possible for his journey. As much as I am impressed with Dolette's clinical expertise, strong work ethic, and attention to detail, I am equally impressed with the compassion and respect she showed my dad. She continually treated him as a person with dignity. It was as if he was her only patient, which of course he was definitely not. My dad was aware of this and appreciative, as am I. Thank you, Dolette. Thank you to the staff at 5 West. I, my dad, and my family are deeply grateful for all you have done to help my dad out in a very difficult situation. With sincere gratitude, Wanda Lichty.
Wow. Doesn't get much better than that, does it? That's amazing. Compassionate, professional, skilled, kind, thinking ahead, all those sorts of things. But making him feel like he's the only patient you have. You did a great job. I'm very proud of you. But I'm sure it's just not my pride you want. Here's some prizes. But you have that as well. So you get a portfolio here that I think is very special with your name on it, signed by a member of the Barnes family, myself. Kleenex, partners with Daisy, but you're doing pretty good. You get a Daisy pin you should wear probably. It's part of the Daisy Club. Daisies. Do we have the banner?
Right here.
Okay, so there'll be a banner with your name there for a month. And then before I tell about this one, there's also cinnamon rolls over there. You have a smaller group today, so you all have to eat 2 or 3. I don't know, see if you can do it. And the cinnamon rolls come in because Patrick's father went to see him one day, and he had one of those big gooey cinnamon rolls, you know, those. And Patrick, and the father was going to eat it for himself, and Patrick said, "Oh, that smells really good. I'll take a bite," and proceeded to eat the whole thing. And then asked his dad to bring him in several mornings for him and the nurses. And the Barnes family wants nurses, all nurses, every time they smell cinnamon, to think about how special they are, because the Barnes family tells a story that every nurse they talked to said, "It's just what I do, it's just my job," which I know we feel that way, but to our patients and families, it's a lot more than that. And so they said, every time you're baking with cinnamon or you smell cinnamon, take a minute and think, all of you, how special you are as nurses. So. And then, I think the best gift of all is a statue called the Healer's Touch. And this is handmade by artists in Zimbabwe, and here's your statue. Artist name, and they are so honored to make these statues for Daisy. One, because healers are very important in their culture, and so they are very honored to do this. But this also, with this partnership with Daisy, feeds over 14 families in this very impoverished nation and makes it able for them to survive. So there's a great story about this on the Daisy website that you should look at, about them making it. And if you ever scratch it, all you have to do is put it in the oven and rub it out. Right. So there's a story about that too. So anything you'd like to say this morning, Dolette?
No, thank you for everything. That's really nice. Thank you so much.
Yeah. Very proud of you. Great way to start the day, isn't it?
Yeah.
So I'm going to put these back in here. Cinnamon rolls, everybody. Help yourself.